At the Eastside Health Network, we do have a variety of different contracts. We have Medicare Advantage contracts, we have commercial contracts, we also do some direct-to-employer agreements, and most recently, we did implement our own accountable care organization in order to support the Medicare Shared Savings Program. In order to make more strategic decisions around our growth and whether we're jumping into further risk on any of our contracts, data is very important, specifically around the cost of care. Cost is changing every single day, every single year, so it's important that we have the data in order to continually evaluate whether we should jump further into risk. Arcadia plays a great part in that, obviously, because they have all the data for us. So all of that data going into the Arcadia system will help us determine should we take on more risk as an organization. Contract performance is very important. It's how we bring in money for our organization. But ultimately, what we're trying to do is have an impact on the patients that we care for. It's important that their data is up to date and accurate so that we can understand all of their needs, close their quality gaps, address any open risk gaps that they have, and make sure that they are receiving good quality coordinated care from our providers within our network. We are able to implement all of our data going into the Arcadia system. So we have live connectors to many of our EMRs. We have claims connectors from all of our payers that go into the system as well. And the platform allows us to produce scorecards and a lot of data that we're able to present at our board meetings and to our providers within the network in order to help them provide good quality care to their patients. Data is very important in order for us to be able to properly care for our patients. We have to understand the entire history of our patients, what they've been through, what medications they've taken, what visits they've had with their primary care doctors or with their specialty doctors. As a clinically integrated network, cost is very important, and we're always trying to keep costs low for our patients. So Arcadia enables us to be able to pull reports out in order to manage the costs of our patients or provide care management for those patients who maybe need a little additional support in order to keep those costs low. Use Arcadia as our platform and able to document the care management work that is being done by our team, but they also use Arcadia to identify the patients that should be enrolled in care management. We pull reports out of Arcadia, we then scrub those reports and really try to focus in on which of our members are most eligible for care management. And then again, we will outreach to them, we will document within the system and make sure that everything to meet the needs of those patients is within one system, that Arcadia system. At Eastside Health Network, we do have 90,000 lives that we cover. We have 4 major hospitals, 42 primary care clinics, and approximately 80 specialty clinics. At any given time, I can pull up the Arcadia system and I can see all of the data that I need on that patient, whether they sought care within our network or outside of our network. All of that data is flowing into one system to allow us to properly care for that patient.